Now we will perform a manual muscle testing assessment for flexion of the shoulder against gravity. When performing manual muscle testing for flexion against gravity, the patient should start in a seated position with the shoulder in slight abduction and the palm facing medially. The therapist should stabilize the scapula and the clavicle, and the patient should flex the shoulder to 90 degrees while slightly adducting and internally rotating the shoulder. The therapist should then apply resistance on the anterior medial aspect of the arm just proximal to the elbow joint, pushing the client in the direction of shoulder extension, slight abduction, and external rotation. The therapist should palpate the anterior deltoid as the pressure is applied. All right, Sarah, I'm going to push you down. Do not let me move you. Hold the test position. Very nice. I would give Sarah a 5 out of 5 because she is able to hold the test position while I give strong resistance. If a patient is unable to achieve shoulder flexion with the weight of gravity, the therapist should conduct manual muscle testing with gravity eliminated. The patient should start in a side-lying position on the non-test side. The arm is at the side with the shoulder in slight abduction and in neutral rotation. The therapist should support the weight of the limb and stabilize the scapula and the clavicle. The patient should flex the shoulder to 90 degrees while slightly adducting and internally rotating the shoulder joint. The therapist should watch for substitution movements like scapular elevation and trunk extension. Nice. All right. Because Sarah is able to move through 90 degrees of flexion in gravity eliminated position, I would give her a 2 out of 5. When performing manual muscle testing for extension against gravity, the patient should start in a prone lying position with the shoulder in internal rotation. The palm should be facing the ceiling. The weight of the trunk is the only stabilizer necessary. The patient will extend the shoulder through full range of motion while maintaining slight shoulder adduction. Okay? The therapist should apply resistance proximal to the elbow joint on the posterior medial aspect of the arm while palpating the latissimus dorsi lateral to the inferior angle of the scapula. Resistance should be in the direction of shoulder flexion and slight abduction. All right, Sarah, don't let me push you down. Good. I would grade Sarah at a 5 out of 5 because she was able to hold the test position against strong resistance.
After assessing active range of motion and passive range of motion, now we're going to assess manual muscle testing. The start position, the patient is prone, the shoulder is abducted to 90 degrees, the arm proximal to the elbow is resting on the bed. An alternate test can be used if the patient has a history of posterior dislocation of the glenohumeral joint and or is unable to assume the prone position or achieve 90 degrees of shoulder abduction. The gravity eliminated position is assumed. I will stabilize the humerus to prevent adduction. The subscapularis is too deep to palpate. What I'm going to do is have the patient move her arm, the palm of her hand towards the ceiling. I'm going to apply resistance to the proximal wrist joint. Okay, Sarah, as I apply resistance, don't let me move you. I'd give Sarah a 5 out of 5 because she was able to hold the position against strong resistance. Here we're in the gravity eliminated position. The patient is sitting, the shoulder is slightly abducted in neutral rotation, and the elbow is flexed at 90 degrees with the forearm in mid position. The humerus is stabilized to prevent shoulder abduction. The patient internally rotates the shoulder by bringing the palm of the hand toward the abdomen. I'd grade this as a 2 out of 5 because the patient is able to complete full range of motion in the gravity eliminated position.
Hi, I will be performing a manual muscle test for shoulder external rotation. This test allows the therapist to see how well the infraspinatus and the teres minor are performing in the movement. The first test is done against gravity. To begin, the patient is prone, the shoulder is abducted to 90 degrees with a towel under the upper arm. The elbow is flexed to 90 degrees and the arm proximal to the elbow is resting on the mat. The therapist stabilizes the humerus to prevent shoulder adduction. The patient externally rotates the shoulder by moving the dorsum of the hand towards the ceiling. The infraspinatus can be palpated over the body of the scapula just inferior to the spine of the scapula. The teres minor is not palpable. Resistance is applied proximal to the wrist joint on the posterior aspect of the forearm as the therapist attempts to move the shoulder out of external rotation. Now don't let me move you. Good. The grade on this against gravity manual muscle test would range from 2+ out of 5 to 5 out of 5. I would grade Charday as a 5 out of 5 because she's able to hold the position against strong pressure. If the patient has a history of anterior dislocation of the shoulder joint, is unable to assume the prone position or achieve 90 degrees of shoulder abduction, then you would test in a gravity-eliminated position. For this, the patient will be sitting with the shoulder adducted in neutral rotation and the elbow flexed to 90 degrees and the forearm in mid-position. The therapist stabilizes the humerus as the patient externally rotates the shoulder by taking the hand away from the body. Good. I would grade Charday as a 2 out of 5 because she was able to move through the full range of motion.